Hello everyone, I am Dr. Kazim Mahmood, consultant orthopedic surgeon. I belong to the Department of Orthopedic Surgery, Sports Medicine and Joint Replacements, Narayana HSR. My expertise is in advanced trauma, doing complex injury cases using minimally invasive techniques, doing keyhole surgeries, which we call as arthroscopy surgeries of shoulder and knee joint. Today, I'll be discussing something called as sports medicine, which is a subspecialty of orthopedics. What entails sports medicine? Sports medicine is a subspecialty of orthopedics which deals with the prevention, treatment, and rehabilitation of athletes. Now, which are the athletes which we deal with? We deal with young athletes, old athletes, elite athletes, high school athletes. We treat them all the same with equal passion, with the goal of returning them back to the pitch as soon as possible so that they can pursue their passion and also bring laurels to our country. So now I'll be discussing about the various types of injuries a sports person or an athlete sustains on the field. The sports injuries can vary anywhere from a simple abrasion, meaning a simple injury to the outer aspect of the skin, to a contusion, meaning internal bleeding of an organ or a muscle, which is appearing as bluish discoloration from the outside. The next major injury is something called as a sprain, wherein the ligament tissue which connects bone to a bone can get ruptured. It can be a grade 1, which has microscopic small tears. Grade 2 is a partial tear. It can be about a 50 to 60% tear of the tissue, or a grade 3 sprain, which we call it as a complete rupture of the ligament. The next important injury is something called as a strain, which we very often hear the sports commentators telling as the sports person has pulled his hamstring or his groin, which means he has torn or injured his musculotendinous units. Tendon means it's a tissue which connects the muscle to the bone. Similarly, like a strain, sprains also have 3 grades: grade 1, grade 2 and grade 3, in which grade 1 are partial tears, grade 2 are 70 to 80% tears, and grade 3 are complete tears. The next important injury is something called as a laceration. Lacerations are usually happening in a contact sport, wherein they can be a blunt laceration or an incisional laceration. Very commonly seen in sports like football, rugby, and other contact sports like wrestling and kabaddi. So now we'll be discussing the more grievous spectrum of the injuries seen by an athlete, especially in contact sports. They can have dislocation of the major joints like shoulder, knee, wherein the joint pops out of its socket, and it's an extremely painful condition unless it's got back into the joint. The other grievous injuries are fractures, which can also not only seen on the field but also over a period of time, what we call as stress fractures. So these are all the gamut of injuries what a sports medicine or an orthopedic surgeon deals with. So we can classify these injuries as acute or chronic. I'll be giving you a very small example for both of these. Acute injury is something what Hardik Pandya sustained during the Cricket World Cup. He had a sprain of his ankle and he was out of the whole World Cup, not only the match. The example for chronic injury is something what Sachin Tendulkar experienced during the 2004 to 2006 season, wherein he suffered from something called as a tennis elbow, which was almost career threatening for him. So, in short, acute injury is something which is faced on the field at that point in time. And chronic is something which is going on for a very long period of time. The sports person has dealt with it and he's somehow dealing with it and continues to play. But in the long run, it would start affecting him, and then the problem becomes more difficult to treat. So once the athlete has sustained this injury, now let us deal with it, right? So how do we go about it? Once the athlete sustains, they have something called as a team physician or a physiotherapist who would give them the first aid and evaluate them primarily on the pitch or the field and assess if the person is able to continue the game or he should stop it to prevent further worsening of the condition. So once we receive the patient to our unit, so what we do is we thoroughly examine the patient, take a detailed history, and after we have come to a diagnosis at the history level and clinical examination, if necessary, we subject the athlete to something called as imaging tests. Imaging tests are of two types. One is to study the bony injury and one is to study the soft tissue injury. The best imaging modalities to study the bony injuries are the X-rays and the CT scans. And if we have to study the soft tissue injuries like ligaments and tendons, the best modality is the MRI scans. So now after the tests, once the diagnosis is established, how do we go about it? So if it is a simple problem, then we can always treat it naturally or conservatively with some anti-inflammatory medications, splintage of the injured part so that the healing ensures. But not all sports injuries are simple. The complex ones need a little more attention. Like we have something called as orthobiologics, wherein we harness the regenerative potential of the young athlete whose mesenchymal cells are injected into the injured area, like for an example, a meniscus or a ligament, and we can regenerate the torn part. So this we call it as orthobiologics or platelet-rich plasma treatment. Even after this, if the things don't settle down, then we go a step up with the use of surgical management, in which we use camera and look into the screen and treat the problem. So once we have established the diagnosis using all the imaging modalities, so how do we go about things? So if the injury is quite minor on the imaging, then we treat them naturally or conservatively using anti-inflammatories and splinting methods so that a period of rest along with the splintage heals the injured part naturally. But not all injuries are minor. Some of the major injuries which don't settle down naturally needs a step-up management in the form of orthobiologics or surgical management. In orthobiologics, we harness the patient's regenerative capacity. We harness the patient's mesenchymal cells, centrifuge them and inject it into the injured part so that healing ensures. But sometimes even after doing this, the torn part or the injured ligaments do not heal. In these kind of patients, we have to go for surgical management, wherein we either repair the injured part or we reconstruct the injured part using keyhole or arthroscopic surgeries, meaning we put small camera into the joint, look into a television, and through a working portal, we fix things up. So after we have fixed the things up, we include a sports physiotherapist, sports nutritionist, and a sports psychologist to do the post-operative rehabilitation, which in a very robust fashion ensures the patient is on the field as early as possible. We at Narayana Health have a very dynamic sports physiotherapist, psychologist, and nutritionist, ensuring a holistic approach to the patient's care.